The World Health Organization has now put the death toll from Ebola at 4,030, the vast majority coming from the West African nations of Liberia, Sierra Leone and Guinea. Passengers from the three African nations will now undergo enhanced screening at designated airports in Great Britain and the United States. Meanwhile, the UN Special Envoy on Ebola, Dr. David Nabarro, has warned that the world might have to live with the disease forever unless almost every country is mobilized to fight it. The presidents of Sierra Leone and Liberia appeared before the IMF and World Bank last week, pleading for more help. As the World Bank warned, the Ebola outbreak could cost the West African economy $32 billion by the end of 2015, unless the epidemic is quickly contained. Later, we'll talk with the former U.S. ambassador to the Republic of Congo, who witnessed the spread of Ebola there in 2002. But we begin with the latest from Liberia and CCTV's Katerina Vittozzi.
The regular and thorough washing of hands in this mixture of chlorine and water has become a regular feature in the lives of Liberians to try and prevent the spread of the contagious Ebola virus. But to help the people that have already contracted the disease, the Liberian president has asked for speedier international help.
More than ever, we need qualified and dedicated staff to join the fight against Ebola, and we need to ensure that it all comes together immediately.
Despite postponing Tuesday's senatorial elections because of the Ebola threat, President Ellen Johnson Sirleaf said she was, quote, cautiously optimistic that Ebola in Liberia was on the decline. However, that isn't a sentiment wholly shared by the man who until recently was heading up the World Health Organization program in Liberia and who now this week became the country's new UN Ebola crisis manager.
Whilst there are some examples that show that it's possible to control the outbreak, this is not a moment to let up, and it's still very much all hands on deck. Build up capacity as fast as we can, because the numbers are still going up. The bottleneck now is making sure that we have trained up healthcare providers to staff the ETUs.
And even over the next few days, we're going to be seeing extra manpower coming to Liberia to help staff those Ebola treatment units, or ETUs. The US military are already here, more will be coming, and 49 Cuban doctors will come to help staff Ebola treatment units and train up local healthcare providers. But how will their safety be guaranteed once they get here? The UN's permanent mission in Liberia, UNMIL, has already had 2 suspected Ebola cases, the latest one this week that led to more than 40 people being quarantined, 20 of them soldiers. That's in addition to nearly 1,300 Nigerian soldiers in quarantine in Liberia after a Sudanese man died within their barracks. In other news, the Liberian government has announced tougher measures with regards to how journalists can cover this Ebola outbreak. They have banned journalists from entering the areas within Ebola treatment centres where patients are receiving treatment. Local journalists say this is an invasion of their freedom of speech, and it's something that they will be taking up with Parliament. However, the President, Ellen Johnson Sirleaf herself, has already asked Parliament for extra authority within the state of emergency. She wants the right to be able to ban public assembly. She wants the right to be able to ban certain religious traditions if she feels that they are in jeopardy of making this Ebola crisis even worse than it already is. However, parliamentarians have voiced their concerns, saying that these tough new measures could lead to a police state in Liberia. Katerina Vittozzi for CCTV, Monrovia.